The Alberta Vaccine Cold Chain Policy provides strict standards for all vaccine handlers to follow in order to maintain safety and potency of provincially funded vaccines. The objectives of this policy include vaccine safety and efficacy, defining cold chain and cold chain breaks, minimizing costs, and providing standards for vaccine handling. Cold chain refers to the optimal maintenance of temperature and light conditions during the transport, storage, and handling of vaccines. Vaccines need to be kept at a temperature range of 2 to 8 degrees Celsius and shouldn't be exposed to direct sunlight or fluorescent lighting. They can become less effective or even destroyed when exposed, and this is referred to as a cold chain break. Fridges and specially packed ice bags are used to store and protect vaccines from exposure, and temperature monitoring devices are used to ensure viability. So because vaccine-specific fridges differ from those that handle food and drinks, anything unrelated to vaccines should not be kept in them. The policy is initiated by the Ministry of Health under the Government of Alberta and is provided under the Public Health Act and Communicable Disease Regulations. The policy affects AHS Public Health, non-public health, community providers, and pharmacies that administer provincially funded vaccines by defining roles and responsibilities for implementation. It's important to maintain viable vaccines because a cold chain break can mean a permanent loss of potency. This can fail to start an immunologic response and lead to outbreaks of vaccine-preventable disease. Vaccines are also quite expensive and are often in short supply in rural communities. Loss of vaccines can result in lost opportunities to immunize, especially in hard-to-reach areas and resource-poor settings. This policy is effective because cold chain maintenance is essential to an effective immunizing system, in which knowledgeable providers ensure vaccine safety and efficacy, meaning a potent and safe vaccine is administered, and as a result, the cost of vaccine wastage is reduced. Before the policy was implemented, vaccines exposed to inappropriate temperatures of light resulted in losses at over $3 million a year, and accounted for 80% of the financial cost of vaccines. 90% of the cases were reported as being due to human error, with 76% of healthcare professionals reporting that they had exposed vaccines to inappropriate temperatures. With the cold chain policy, only 9 out of approximately 15,000 vials are discarded, as compared to higher numbers in years prior to the policy's implementation. Strengths of this policy include how it informs us on preventing cold chain breaks and explains the roles and responsibilities of providers, that it's continuously reviewed every 3 years or is needed according to new research, and that it requires all staff working with vaccines to undergo orientation and training in vaccine storage and handling. However, some critiques of the policy include how it only applies to provincially funded vaccines, meaning that non-provincially funded vaccines are a risk for unsafe or ineffective administration, as well as how not all of the policy audits are completed through AHS. For example, pharmacy audits are conducted by the Alberta College of Pharmacy. Therefore, the policy could be modified to cover how audits are completed to ensure compliance. So in contrast to storage and transportation available in urban areas, low-resource settings such as rural and remote areas may face more difficulties implementing the cold chain policy. There's the potential for power cuts to refrigerators, lack of consistent temperature maintenance, increased reliance on human observation, and inadequate resolutions to cold chain problems. Higher staff turnover can also occur in rural settings, and proper training is costly, therefore knowledge may be reduced on cold chain protocols. Errors can also occur in the delivery of vaccines to rural and remote populations. With potential energy failures and inadequate protection in varying temperatures, there's more risk with every additional step. More resources could therefore be devoted in order to safely implement the policy. Overall, as future ends, we support this policy in its current format. The advantages of having a policy that ensures safe and potent vaccines outlines an important part of primary care, which is the foundation of building healthier communities and a strong, sustainable healthcare system. Immunization is a crucial aspect of public health services, and a well-managed cold chain increases the efficiency of the system, improving patient outcomes. This policy specifically gives providers the required knowledge to be able to safely maintain the cold chain in accordance with CARNA's Practice Standard 2.1, Knowledge-Based Practice. Immunization rates increased 10.3% 18 months after being educated with the policy, with providers' knowledge increasing 7.8% 12 months post-education. Overall, this policy helps us deliver safe and potent vaccines to protect both ourselves and the people around us from vaccine-preventable diseases.